I am Dr. Thompson, Akwo, Ntuba, international physician, political leader, and international communicator, certified professional and expert in global health, certified professional and expert in global health USA, subspecializing in global health communication and medical communication, or what we call medcoms. During this 2021 International Day of Stroke, I want to speak to you on the global health aspects of stroke and what you should look out for as an individual, as a member of a family, or a group among your friends. Every year you hear that stroke kills a person in the US every 4 minutes. And that's every 40 seconds, somebody comes up with stroke somewhere. And that stroke, or CVS, the cerebrovascular accidents, are the fifth leading cause of death in the United States. They may be higher in other Western countries. And they are part of what we call the non-communicable diseases or chronic diseases that we deal with on the global health setting. So the cerebrovascular accidents, cerebral has to do with the brain. Vascular has to do with the cardiovascular system, the blood flow, the heart, the arteries, the veins, the capillaries, the arterioles. Accident. So every time that we have a certain compromise of neurological functioning because of a sudden accident or injurious effect on the brain that compromises the cardiovascular function or the blood supply or the blood flow of the brain or parts of the brain, and their accompanying neurological effects and impacts that may actually manifest in different ways and in different parts of the body. We are dealing with a stroke. Strokes or cardiovascular accidents, CVS, have contributed in what we call a double burden of diseases, as we see in lower middle income countries presently in Africa, in the America, South America, Eastern Europe, and part of Asia, places in India. Because the lifestyle and affluence of these communities and people and populations is also letting them get involved in lifestyles that predispose and risk them into having stroke. And so it is a good time during the season of sports and the soccers and, the bidding for the 2026 FIFA World Cup and the quarter preparation for the World Cup next year and the AFCON in Africa, and all of that, to talk about some of the behaviors that may predispose to stroke. Diets, sedentary lifestyles that dampen your blood flow, lack of exercise. A good example, those of us who are in the United States of America, it is not unusual for you to see people who live in their homes and they get out of bed directly to their kitchen and dress up and get to the garage, enter the car and drive to, their workplace garage, and then get into the lift, and that takes them directly into their office. In the most times, they don't really physically exert themselves. That's a sedentary form of lifestyle which predisposes, or which is a risk factor for stroke. For others, it is the diet. Eating things which are not healthy, fatty foods and things like that predispose to high cholesterol level, atherosclerosis, high blood pressure, and related things. For others, it is diabetes that will lead to stroke as a complication of diabetes, because diabetes actually affects the integrity and the architectural build-up of the blood vessels and the other tissues and organs of the cardiovascular system, the heart. Some people have heart diseases and heart problems which lead to atrial fibrillation, and there are related problems that have led to severe cardiovascular diseases or strokes. High blood pressure. Now, strokes can happen in any age, but they are predominantly happening in the elderly, even though we see people who are in their 40s, early 50s coming up with stroke more nowadays. But we don't see many young people coming up with strokes or children. That, notwithstanding, stroke can occur in any age group, as we have experience in clinical practice, in curative practice, in global health practice around the world. Stroke actually will present in a certain way depending on the type and the location of the brain where it occurs. We have predominantly two types, even though there is a third type which we call the TIA, the transit ischemic attack. Now, the TIA itself talks about ischemia. So there are people who have grouped that as a subtype of the ischemic stroke. The ischemic stroke have been actually called thrombotic stroke by certain consultants and experts in medical schools and places. You know that consultants, the experts, have a way to defend whatever they say in the practice of medicine, before panels. And so we can let the professors and the experts decide, but generally we have ischemic stroke. Ischemia is a compromise of blood flow. And as stroke is concerned, which is a neurological problem on its own, related to cardiovascular events is a compromise of blood flow to a part of the brain. And as I said, depending on the type and the place, we can have different types of symptoms or features of a stroke. So, ischemic stroke, or that which is the compromise or reduction or even cessation or arrest of blood flow and supply to a part of the brain, will lead to stroke. And there are events that lead to that. One is a thrombus and the other is an emboli. Those two words, they are technically similar but different. An emboli is a clot from a distant part of the body that sits in the bloodstream, like if you think about water carrying, debris, and actually begins to move that to certain parts of the body. And as it goes through the carotid arteries and going up, it gets to smaller vessels. And as it gets to those smaller vessels, it begins to block them. And when that happens within the brain, the part of the brain that gets its oxygenation from the blood that is supplied through that vessel is compromised. And so you have effects in the body because of that. So we have thrombotic stroke, ischemic thrombotic stroke. We have ischemic embolic strokes. And many of the times when the heart has a problem, when there's a form of an infarct or some dying, as we would say in the layman's term, of a part of the heart for one reason or the other, there begins to be a collection on that part, and it becomes the foundation for a clot to be formed. And then that clot is moved when the heart pumps blood through the carotids to the brain, and it becomes an agent of blockage. And then we have, as I said, an emboli for people who have deep venous thrombosis and other related things. There's a clot somewhere, and then it's discharged. It sits into the bloodstream and begins to move up. So those are ischemic strokes for you. And then, as I said, there's what we call the transient ischemic attack, where we just have a sudden obstruction of blood to a part of the brain for certain blockages which are just transient. Transient means just a short time. It could be a few minutes. For some, it could be like a few hours, but I wonder how many people want to put many hours of blockage to be a transient thing, because transient just means transient, what it means, short time. So it could be like a few minutes, a few seconds, where you feel like maybe dizzy, you're confused here, Then the other type of stroke is what we call the hemorrhagic stroke. So when you hear hemorrhage, it means blood, bleeding. Now, of the 100%, if you have 100 people who have a stroke or CVS, 80% of them come up with what we call the ischemic or the thrombotic stroke, because the emboli itself is a form of a thrombus. So, where they have interchange ischemic strokes for thrombotic stroke mean the same thing. But in the informational that I am giving you as part of this 2021 International Stroke Day, I want you to know these differences. As I said, a hemorrhage is a bleeding somewhere. It's a bleeding. If I prick my hand or cut my hand, what do? I hemorrhage blood. Blood starts flowing out. The same process can take place within your brain. If you have an accident, you can start bleeding inside your head. You have subarachnoid hemorrhage, or but we just, for you, the lay people out there, just call it, brain bleeding inside the brain. That is not very, very common. That will compromise the blood flow in the brain and lead to neurological deficits, which we see in cardiovascular diseases or strokes in clinical practice. But 20% of all strokes are hemorrhagic strokes. And one of the ways that a hemorrhage happens in the brain is what we call the bursting of aneurysms. Slightly, there may be parts of the blood vessels which supply the brain, whose walls begins to weaken up, and then the burst off. And when that happens, the blood just keeps flowing. And it doesn't supply the brain, but it just accumulates. And you could be having headaches. For some people, it could accumulate until you have seizures. So those are the two major ways that strokes actually happen. As I said, they are neurological deficits. And those neurological deficits will manifest in the form of symptoms. And as I said, the symptoms will be based on what part of the brain is affected. For some, it is a weakness of the facial nerve, and a part of your jaw just sinks. For some, it is your limbs. Some people may be having paralysis in one side of the body, hemiplegia, or quadriplegia, or all four, but most of the times they may be limited to a particular part of the body where that happens. So you may have headaches, confusion, inability to move one part of your limb, and all of those. Those are some of the symptoms of stroke, which a lot of you need to know, because then you need to act fast. If you don't know that, how do you act fast? If you don't know that, how do you act fast? Because with acting fast, you have to be fast, as they say in Memora Harmony, in their stroke work. Balance, when there is the issue of balance, you may have problems. Your eyes, your face, and as I talked about, dropping of a part of your face, the arms, your speech, the timing. So those features of stroke are very, very important, because there are medications like Alteplase, which can be used to break down, the clots in the thrombotic stroke, which I said mostly at the 80% of the cases. Because when you delay and everything, then they may need to do an endovascular type of surgery. That is when you delay. But some of the tests which are used will be related to the heart and the brain. So most times an MRI, the magnetic resonance imaging is done, the CT scan imaging, the intravenous Alteplase can be used as a form of treatment. So there are those treatments which are there. In the most part, how to prevent stroke: exercise, diet, reduction of sugary foods, checking of your blood pressure, control of diabetes, reduction of stress, because stress on their own, they can lead to, increase in high blood pressure. So good social networking and other things, exercise, sports, soccer, baseball, and all of those. Those are the ways.